are not the part of joint hernia, but they are in the near vicinity, therefore they are included under both the topics. Ventral hernia means abdominal wall hernia as well as groin. So they are indirect and direct inguinal hernias and femoral hernias. Inguinal hernias, we know the anatomy. Inguinal hernias can be classified as direct or indirect. The indirect hernias are more common, most common types, 5 times more common than direct hernias. And in boys, it may be the result of patent process of vaginalis. In adults, it is acquired as a result of weakness and dilatation of internal inguinal vein. Maybe by whatever reason, raising abdominal pressure or chronic cough or whatever. So, and important, delayed or incomplete closure of the canal of neck can occur in females. So, this is normal anatomy. So, how to identify the pubic tubercle and entire right inguinal canal. This is pubic tubercle, this is spermatic cord, and we are evaluating the entire inguinal canal. This is internal ring. Here is the internal ring. Okay, so this is again normal evaluation. From here to this is along the spermatic cord, we will be looking at here is the pubic tubercle. Okay, the neck of an indirect inguinal hernia is the segment that lies within the internal ring, and the fundus lies within the inguinal canal, but may go down up to the head of epididymis, or even it may go all around testicle. The fundus of an indirect inguinal hernia lies anterior and lateral to the spermatic cord in males and round ligament in females. In the short excessive, internal ring and the neck of indirect inguinal hernia lies between the external iliac artery along its lateral side and inferior epigastric artery along its medial side.
So sorry, we are running out of time, so if you could.
Okay. So these are inguinal, indirect and inguinal hernias. I will direct inguinal hernias accordingly. I will show one case pantaloon hernia. This will include both types of examples. So it on lying axis the neck resembles pant legs straddling the inferior epigastric vessels and includes two components. One is indirect inguinal hernia and other will be direct inguinal hernia. To remember is the indirect component enters through the lateral segment, lateral part of inguinal canal. Means lateral entry is observed, and for direct inguinal hernia there is posterior entry of the sac. So this is the clip where we see this is. What is this? Lateral entry. We are looking at the lateral entry, and if we move forward, here is there is a posterior entry of the sac. So that way we demonstrate canal of neck hernia. Accordingly, it can occur. This was 5-year female child. This is 5-year male child. I will bypass now. This was encysted hydrocele of canal of neck 28 inches to 28 years female. So here is the encysted hydrocele. Encysted because it was blocked. The procession vaginalis was closed, below and above. This was one case femoral hernia. I will show 70 years female. I will move it forward to know the location. This is femoral artery, this is femoral vein, and this is femoral hernia. Here we start fluid as well as part of bowel. So these were where hernia complications incarceration means simply non-reducible. Obstruction means non-reducible with mechanical obstruction. Strangulation means non-reducible with vascular compromise of the contents. and all obstructed and strangulated hernias are incarcerated hernias, but majority of incarcerated hernias are not obstructed or strangulated. So in conclusion, dynamic ultrasound is the most important component for evaluation of hernia. Dynamic components include Valsalva, coupling, compression maneuvers, scanning in both supine and upright positions. Dynamic sonography enables clinicians to determine hernia type, size, contents, reducibility, and tenderness. Patients with one hernia may have multiple hernias, so need is there to evaluate thoroughly. Strangulation is the most dreaded complication, particularly with narrow necked ones. 2D findings of strangulation are hyperechoic fat, isoechoic thickening of the hernia sac, fluid within the sac, and thickening of the walls of bowel lobes. All are more sensitive for strangulation than is Doppler ultrasound. So Doppler is not so sensitive than this 2D finding. So recurrence is not uncommon even if the mesh is used where it arises from the edges of the mesh. Ultrasound is the imaging modality of choice. Thank you, Kanubala sir.